because we cannot compromise on the quality of the treatment. So what we should look for in a brand?
You can even order it on a food delivery app.
How do we know that if the treatment is progressing well according to how we have planned?
So can aligner treatments fail?
But definitely we need to assess the bone level and the condition of the patient before starting in treatment.
Always go for the most reliable brand, a brand who doesn't compromise on the quality.
Welcome to DentCare Talks. Myself, Dr. Jemin Elizabeth Matthew. I'm a prosthodontist and technical manager Marcom at DentCare. So are you looking for perfecting your smiles, or are you perfecting your craft to create perfect smiles? We are here today to address some of the top queries on aligners, bursting some myths and setting realistic expectations. Joining me today, we have Dr. Vishnu, who is an orthodontist and head of department at DentCare Aligners. We have Dr. Binu, who is an orthodontist and technical advisor and faculty at DentCare Aligners. We have Dr. Linda, who is an orthodontist and senior quality specialist at DentCare Aligners. So aligners are so much in trend today and everybody wants a perfect smile. So can aligners replace braces?
We cannot say that it completely replaces braces, but it can actually treat, we can actually treat around 90% of cases with aligners. Only with regard to certain complex cases, like for example surgical cases and skeletal cases, we cannot treat with aligners.
Now it's the era of AI, like Meta has AI, ChatGPT. So all the patients would have done a basic kind of search before coming to the clinic. So even if the patient is demanding an aligner treatment, it's always better you do a good case selection. Talk to the patient for a good 10 to 15 minutes, then understand what the patient is expecting out of the treatment. So if you see that it's not a case ideal for an aligner treatment, it's always better to go for a fixed treatment rather than taking up an aligner case and finally not delivering the result what the patient is expecting.
And cases like the almost like severe debite cases, like more than 4 mm and even cover bites, like the lower anteriors is not visible at all. Such cases are like we have a restriction to treat with aligners. Even open bite cases, which are like more than 4 mm open bites, that also is very it's like a contraindication for aligner treatments. And scissor bites are also hard to correct. So such cases we don't.
So what expectation a patient should have in mind before they get an aligner treatment? Like, are all movements possible with aligners?
Most of the movements are possible, but severe rotations, like more than 60-degree rotations, are not advisable. But then with auxiliaries like buttons and elastics, that too, like almost 60-degree kind of rotations are possible.
Just to add on to that, for example, severe deep bite cases or cover bite, which we already discussed. So in such cases, the lower incisors won't be visible at all. So in case of conventional orthodontics, what we do is we make use of a principle known as relative intrusion, where we intrude the anteriors and we extrude the posteriors. But extrusion becomes a problem. In aligners, extrusion is always a challenge. Just with an aligner, we'll not be able to do the extrusion. Yeah. So that is why in such cases, we need to avoid aligners. So that is one thing you have to keep in mind.
And can we go ahead with the aligner treatment if you have a prosthesis in your mouth, like if you have a crown or if you have an RC treated teeth? Can we still get an aligner treatment?
Yes, actually we can. Like it depends on the scenario. So basically, if we have like for example a single crown, a single RCT treated, we can definitely go ahead with an aligner treatment. But if the patient has a bridge or implant, then for example in implants case we cannot go ahead with the treatment. But if the patient has a bridge, we need to either separate, as in section the individual crowns, and then we can go ahead with the treatment. Otherwise it's not actually possible.
We need to see where the movement is happening. So if the bridge is in the posteriors and we just need to move the anteriors, it's okay. Otherwise, if the bridge is there in the area where we are indenting a tooth movement.
So isn't anterior, if you have an anterior bridge or a crown, isn't it tricky?
Yeah, it is not advisable because the problem is we'll not be able to direct the forces exactly like how we are planning. So that is the main problem regarding that.
And veneers and crowns, especially in the anteriors, intrusion is very restricted in that area, because we already have a margin for crowns. Yes. And veneers. So intrusion, like in deep bite cases, the intrusion will not be possible in such cases.
And I feel orthodontic treatment, like if you talk about 10 years back, it was like a treatment for youngsters. but now it has become a treatment like irrespective of age. Everybody want braces, everybody
True.
want aligners. It
Yeah.
has become like irrespective of age. So is there a limit for the age?
No, actually there is no such thing as an age limit, but definitely we need to assess the bone level and the condition of the patient before starting in treatment. For example, we need to assess it with the X-ray, and we need to assess it with the periodontal condition of the patient, so that we can go ahead with the treatment. There is no such thing as an age limit.
So I'm reminded, when I heard this, I'm reminded of one of the cases which came to us like a few months back. So that was our own doctor's mom. So that was her dream to get the alignment corrected. So she was around 72 years. But since she was doctor's mom, her oral prophylaxis, everything was done correctly, periodically. And so when we saw the bone level, it was fine. So we gave the aligners and she's doing well right now. So there's no upper age limit. We just need to assess the periodontal condition and then we can go ahead if everything is fine.
So if the periodontal health is good, if the bone levels are fine, actually irrespective of age, we can go ahead with the
Yes.
treatment.
And mostly we prefer on fully erupted permanent teeth, and we maximum treat all like even adults in the sense from 14 years. Most of the cases are from 14 years. Mixed dentitions, we don't actually prefer doing mixed dentitions, but there are brands which
I would like to add one more point to that actually. Basically, one thing to keep in consideration while doing the treatment, like planning the treatment in patients, for example, say above 50 years, we need to look at the amount of surface area present in the teeth also. Like with age, attrition happens.
Yeah, generally the aligner will fit onto the teeth so that we can get the desired result. So that is
In
also
such
another
cases, going for a full mouth rehabilitation will be a
thing. Yeah,
good
that
choice.
will be a
Definitely,
good choice.
yeah.
Yes.
That's
and you can even go for single crowns and then go for treatment. And when we come to for gaining space and attrition, like the teeth with attreated surfaces, we cannot do space gaining.
Okay.
So that cases will be complicated and it will be compromised too. So you can go for separate crowns in such cases and then do aligners for alignment.
Okay. And I feel one important factor when we talk about aligners is the aesthetics. This is the new generation, the selfie generation, and the Gen Zs. They don't want the braces to be seen because all days photographs were like from a far distance, but now we take a lot of selfies. They don't want their braces to be seen. So how much does aligner has a role in such new generation?
So like you mentioned, now it's the era of selfie. All of us would have at least looked into the front camera at least once now.
Yeah.
So it's
Before
not like
sitting here.
yeah, it's not like
true.
years back when photos were taken from far. So when they keep the phone in front, they don't want to show out that they are undergoing some kind of aesthetic treatment. So this is an ideal choice because it's hardly visible. So when you talk also, there's hardly any problem that is there. So that is an ideal choice for people who are looking from an aesthetic point of view, provided that case is suitable for an aligner treatment.
And one question I frequently get is there any food restrictions for aligners?
No, actually that's one more one more advantage of aligner treatment, because the patient can actually eat whatever they want, and they can remove the aligner and they can have whatever food items they want to eat, which it won't be actually possible in conventional treatment, that is braces treatment, because in conventional treatment we give them a particular set of do's and don'ts, as in you are not supposed to eat this kind of food because it will delay the treatment.
One incident what I would like to share is I went for consultation last month and I got a patient for traditional braces, and he came with a broken bracket in 4 premolars, canines and all, and also the buccal tube. So I asked him what happened. So he was like, he ate the Kerala snack muruk. So that is that is one thing which we tell them not to have, hard food. But somehow the new generation kids, they don't like to be dictated on what to eat, what not to eat. So in such cases, this is an ideal choice because they take it out and have. So they can eat anything and everything, just like how it was before the treatment started. They can have anything. So that is one advantage.
And the celebrities, they all are concerned about their aesthetics and their smile and all. So many years back, they didn't have an option to correct their teeth. Maybe they had to go for some other options. So like invisible braces and all. So now it is the best option for for celebrities and even the media professionals. They can go for aligners and nobody's gonna know that they're undergoing a treatment. So I think
everybody is social media celebrities, influencers.
Yeah, all of them we could see only influencers around. Out of 10 people, 8 would be influencers. So I think that is a good option. It's the best option for them to treat their treat their malocclusion.
Okay. So aligners, can we categorize, like, are aligners a clear shot treatment for some malocclusion or some variety of problems like spacing or crowding? Like, how do you go about it?
Actually, like, when you mentioned that, we can actually say that for spacing, right? We
Spacing,
can
yes.
actually say it's actually better compared to like conventional treatment, that is braces, because the duration will be less and the spaces will.
So minor
it will
spacing and all we can
complete-
close in as less as
Yeah.
2 to 3 months. So that is why it can give faster result. So that is the major advantage in case of spacing. And also for mild to moderate crowding also this is an ideal choice.
Especially when you talk about duration, I think like one of the important query any person who's getting an orthodontic treatment is how long this is going to take. Like most of the conventional treatment, I feel like they used to take a lot of time and they don't have the patience for such
time.
duration. How much does on an average aligner treatment will take?
Most of these spacing cases would be like maximum of 6 months. Like it is like according to the complexity of the case. But then even crowding cases, severely crowded, it might take more than a year. Like with very severely crowded cases and extraction cases and all. But most of the moderate cases will take like more of 6 to 8 months, not more than that.
So 2 weeks back, a patient came to the clinic. So the patient is complaining, actually she got aligner treatment done twice, and still she has not got the expected result. So she's very unhappy with the treatment. So on examination, what I found was the current aligner which is present in her mouth was loose. So how do you want to explain on that? Like, what went wrong with this patient?
The aligner fit. You always given 0 tray before the aligners are delivered. The actual aligners are delivered. So the doctor should look into a point that the aligner goes and fits into your mouth. It shouldn't be either tight, neither too tight nor too loose. So it should be having a fit, a seat, on your teeth, and it should be fitting all of your teeth, not only one side or two sides. And the patient should do a pressure to remove it. So that should be the ideal
Like
thing.
a snug fit.
Snug fit, yeah.
Many a times, doctors ask, like, how do we know that if the treatment is progressing well according to how we have planned? So I'll just give you an example. For example, if the patient is in 5th stage, if the aligner is fitting properly, 5th stage aligner is fitting properly on all the tooth surface, we can be rest assured that, okay, whatever movement we have planned till 5th stage has happened. So that is one thing you have to see. So that is why that patient you are talking about, probably the patient was not aware about the fit, because the aligner should properly fit. Otherwise, if it is loose, means whatever movements we have planned won't happen. So that is why it should fit properly on all the tooth surfaces.
So it is very important for the patient to convey to the dentist that in case if the aligner is not rightly fitting in the mouth, because it is very crucial for the progress of the treatment and the outcome of the treatment. And when we, one common query which we get is, if I have an impacted 8, so should I get it extracted before aligner treatment?
See, if it is interfering with the tooth movement, it's definitely should be extracted. But otherwise, we can go ahead with planning the normal treatment.
I'll add on a question along with that. I have an aligner, but my 8 is not covered.
So that is what, when we are talking about the 8 or the 3rd molar, that is very important to take the impression or include 8 or the 3rd molar when you take the impression or scan and send. Otherwise, what will happen is, when the aligner treatment is over, the 8s will supra-erupt. Supra-erupt means it will come out of the occlusal level. So at the end of the treatment, what will happen? The 8s only will be in contact. So that can lead to TMJ problems, a lot of other complications, open bite, patient won't be able to chew. So that is why if the 8s or the 3rd molars are erupted, you have to include it. At least half of the tooth or the first cusp, you have to include in the aligners.
Basically, we should cover all the posterior teeth which we
all
have
these,
erupted. All
like,
the teeth.
Yeah, all the teeth, at least one cusp of the, 3rd molars, so that it doesn't supra erupt and it doesn't have, or else it would be, the patient will have issues chewing. Functionality will reduce.
So I feel because for aligner treatment, most of the dentists can take a scan of the upper and lower scan of the patient, and in case if the 8 is distally tilted, I feel most of the time, okay, we don't need the 8. So that's a doubt mostly dentists ask.
Yeah, that
do
is
we
a
need
misconception
the 8?
actually.
Yeah.
But it's always, it should be ideal actually. It's not, we can't say it means it's better.
So
we
at
should
least
say
the
it's ideal.
mesial
Yes.
cusp has
Otherwise,
to
they
be
should
there.
extract it. That's it.
Prior to the
yeah,
treatment.
Yeah,
prior
if it is
treatment.
buccal coated or any other thing,
Yeah,
then you
if
can.
it is
Actually, there are so many aligners in market today. Like, there are so many brands which provide aligner. And is there something which we dentists should look for in a brand, or because we cannot compromise on the quality of the treatment? So, what we should look for in a brand?
Always go for the most reliable brand, a brand who doesn't compromise on the quality. Because quality means now, as you said, there are a lot of brands, and if the material is not, ideal, or material is not stiff enough for movements to happen, that will lead to breakages. When I talk to many of my colleagues, they complain of this because they'll give the aligners and the patient is coming back after 2 to 3 days telling that the aligner is broken. So in such a case, we'll not be able to give the desired result to the patient. So that is why when you choose an aligner, and the second thing is, when they go for an aligner treatment, make sure that the treatment is planned according to orthodontic biomechanics.
Yeah.
Then only the stability also will be there. So these things you have to keep in mind.
I feel there are so many DIY aligners.
you
That
can even
is like-
order it on a food delivery app.
Yeah,
apps, we
actually,
see
You can
the
book a
ads, right?
scan on a food delivery app, and they come and scan at home, and it's delivered directly to the patients.
Are they reliable? Like,
No, we would never actually recommend it because, like, basically the concept of that is like the patient is not in a direct contact with the dentist or
Yes.
orthodontist or a dental professional. So, like earlier, the doctors, they actually mentioned, even the importance of taking a scan. Like, the importance of taking a scan. So, how will the patient know that, like, the treatment is going according to the orthodontic principles? So, all these factors should be taken into consideration. So,
The other day, I was just talking to a friend who is in a metro city. So what he was telling is he ordered a scan through an online app, and the person came, took the scan, and they went. That shouldn't be how it's done. Like dental treatment means it should always go through a dentist's hand, and because a lot of intricacies are there, which they should.
and I
take
lot
feel
of
they are
factors are
not
there.
aware about,
What if the patient has a systemic disease?
exactly.
What if the patient has a bleeding disorder?
Yeah.
Like you never know what there is an underlying issue. If there is a medical history, if there is a jaw surgery done, or an accidental case, all these matters. But when a non-dental professional goes and scans at home and delivers a aligner, a set of aligners at home, we never know what would happen post treatment or during the treatment.
But nowadays, people want everything fast, so that is why they are, deceived by all these things. That shouldn't be encouraged actually.
When we are talking about the systemic conditions, can you enumerate few conditions where it's like a no for aligner treatment?
for example, like when the patient has a bleeding disorder, like most of our treatment, like it takes into consideration, like the treatment plan might have extractions or interproximal reduction, which we call as IPR. So in such cases, we actually cannot go ahead with aligner treatment if the patient has an underlying disorder, because then the bleeding, clotting time, all these factors will come into picture.
And also in case of diabetic patients, we should be careful because their salivation will be less, So in such a case, when the patient wears the aligner, the patient can be more caries prone because there's no salivation. So that can also be a problem. So all these
I
factors.
feel even bone disorders.
Bone disorders
Yeah,
too, like
that is-
osteoporosis and all these systemic diseases is contraindicated for aligner treatment. Like even orthodontic treatment, not only aligners, but even orthodontic treatment.
I feel like aligner treatment has now become a thing, like especially people who are migrating abroad. How important is it to convey to the patients the importance of follow-up in aligners?
See, actually follow-up is very important, but like you said, one major advantage of aligners is that we can actually suggest it to NRI patients. But then again, like what we would actually recommend them is to at least take a video or a photo and then be in constant contact with the doctors.
Now the problem is
that,
due to extensive marketing of various aligner brands. People think that just like single visit endodontics, they think that it's a single visit orthodontics. You come, take the tray, go, and then everything will be fine. No, it's not magic or anything. Because all the principles that is happening in orthodontics, same thing happens here also. So for that to happen, the patient has to wear it full time. Then they have to ensure the fit. So at least if the patient is going abroad, when the patient goes from one stage to the other, they can send a photo or a video consultation they can do. So in case of any troubleshooting that has to be done, they can do it in between the treatment like that.
As you were talking about the photographs and everything, what all are required for when a dentist communicate with the lab? Like what all are necessary for the lab to treatment plan the case?
See, we'll actually, the most important thing is definitely we will require the chief complaint of the patient, like what the patient actually wants, the age of the patient to take into consideration all the bone level factors and as such, and then we would require the scan or a model, and then we would require photographs.
So photographs means we would
Yeah.
require 5 intraoral photographs and 3 extraoral, because the orthodontist sitting in the lab is not seeing the patient. So
Yeah.
depending on the records doctors give only, we'll get an idea on how the patient's profile is, because all that plays a very important role in treatment planning. So those are the records which we require.
In some skeletal cases, we ask for cephalograms too, and for more further investigations, we ask for CBCT too, like in cases of impactions, canine impactions, and all.
So radiographs are mandatory.
Yeah,
OPG
it
is,
is.
OPG is
OPG
mandatory,
is
because
mandatory.
that will give us an
Yeah.
idea of the bone level, and if there's any bone pathology, impacted teeth, everything we'll get an idea with OPG.
And individual radiolucencies, we ask for IOPS too.
And sometimes there is a question which is commonly asked, like to create space, we do extractions prior to orthodontic treatment. Are there any other methods apart from extractions? And also, to add on to this question, is the extraction decided by the consulting dentist or is it decided by the lab?
Okay, so basically I'll answer the second part first. The treatment plan is actually decided by the lab, by like our orthodontist team, but definitely like we will take into consideration the treatment suggestions which are provided by the orthodontist or the dentist. We'll definitely take into consideration what they have any extraction plan in mind, and if it is possible we'll try to do it maximum like according
Can a
to their.
dentist actually understand, like I'm just curious, maybe an experienced orthodontist can predict
When
how
they see
much...
the
Yes,
case,
yes.
if they see that there's an arch length tooth material discrepancy, definitely there's some kind of space gaining that has to be done.
Yeah.
So like your first part of the question, other than extraction, other methods of gaining space are IPR is there, interproximal reduction, then little bit of arch expansion we can do,
Yeah.
distalization, all these are there. So depending on case, if there is not huge amount of space required for like extraction, then we can correct it using IPR or
IPR,
interproximal reduction. That is also another way.
So when you reduce it from the proximal areas, can it result in sensitivity or any...
Not necessary. Like we normally reduce it ideally, right? Like only
Within the limits.
only the enamel will be reduced and will be reduced minimally.
Okay.
Like only to an extent that the patient doesn't have any issues.
And what if the patient is caries prone? Like,
Then we have to go for fluoride application. Anyway, fluoride application is mandatory
Is mandatory.
for
Two
post
important
IPS.
things which doctors have to look for is, one, they have to do good polishing with at
Yeah.
least with polishing strips or polishing burrs, so that there's no plaque accumulation that can happen. Then when they do the IPR, also make sure that anatomy of the tooth is preserved. Otherwise, what will happen is, if just cervically more reduction is done, it can lead to black triangle. If incisely more reduction is done, it will lead to
The space will not
V-shape gap will be there.
space
That
will not close properly.
that can cause
And
food lodgement.
Yeah,
and
it
and
can
I
even
feel
show.
especially anterior area, if
Yeah.
you get the black triangles,
looks
It looks
awkward.
it
Yeah.
looks very it looks very unaesthetic.
So basically what we focus is on that the walls should be parallel.
Parallel.
That's what like one basic this thing what we can.
And it should be very like polished. It should not be serrated. The cutting edges should not be serrated. It should be well polished. So it will be like less complicated.
That is why we
and
advise it's
complex.
always better to get a new scan or model once the IPR is done,
true.
so that if there's any problem we can correct it before the treatment.
Yes, yes.
So if you just do the IPR virtually and send the trace directly, all these corrections can't be done. So it's good to evaluate once the IPR is done.
It's a very technique sensitive
Yes, yes.
procedure also, because we operate in millimeters, like less than that.
0.2, 0.3.
0.3. So like to get a clear picture, like Binu said, we definitely need to get a new scan after each IPR, so that we can plan the treatment accordingly and to see if it conforms to our original treatment plan.
so are aligner treatments expensive?
It is like it is expensive, but like you can even manage according to the brands and all. It varies too. So it starts around 50,000, and it can go
So I
up
think
to
it
2 to
depends
3
on the
lakhs.
case.
Yeah, it
Yes.
depends
And
on the
complexity of the
severity
case,
of the
duration of the case, number of trays. So when the case is complex, the number of trays will increase. The duration of the treatment will increase. So definitely, it will the price of the aligners will increase according to the duration
Just like
and number of
braces, we
trays.
cannot standardize like it will
Yeah.
be this much, because depending on the case, like doctor said, when the number of trays go up, definitely the treatment
Treatment
cost also
cost
will go up.
Before getting an aligner treatment, I think you explain to the patient using a visual simulation method. There are some patients who come back and say, this was supposed to be my outcome, but I have not got the complete result. So how much reliable is this visual simulation which you provide to the patient?
We can say that it is almost 95% reliable actually, but provided the patient is compliant. So if that is if the patient is compliant, there is only a scope of 5% error, but definitely we should always leave that 5% aside for minor corrections, minor movements which
So this
might not
video
happen.
simulation, another advantage is that we can show the patient how their treatment outcome will be before starting the treatment. In braces, we can just verbally communicate to the patient, like once your treatment is over, your space will close or your teeth will go inside. But here this serves as a visual because definitely patients are paying more, so they'll get a better idea. So if any corrections have to be done before starting the treatment itself, they can correct it accordingly.
As we have a lot of migrating youngsters these days, one frequent doubt most of them ask is, like, I have a fixed orthodontic treatment ongoing right now. Can I break it and continue to, can I shift my treatment to aligners? Is it possible?
Yes, of course they can do that, but they should have a follow up with their dentist who is doing the treatment. So that is one point. Follow up is very important, even if it's an aligner treatment.
So since you told about fixed orthodontic, one more point what I would like to add is, in certain complicated cases like we discussed, deep bite cases or class 2 division 2 cases and all, we can go for a hybrid method to get a better outcome. So last month we got a case from Noida. So there what happened was, it was a division 2 case and patient had 3 months. So we did a initial bonding, 2x4 appliance we bonded, then proclined the anteriors and then patient had to go, so we gave the aligners. So that will ensure a better finish and better result to the patient. So many times now doctors are asking for hybrid method also, where we do an initial phase of bonding, treat the complicated malocclusion and then finish the rest with aligners.
And when we talk with regard to, there are different durations or different types of aligners which are available in market today, which are faster. The treatment, a set of tray takes only like 7 days, some set of trays take 10 days. So some take more than that. So what is the difference between all these kind of duration which is present, or is it because of the type of material or the type of tray it is used?
Basically it depends on the material composition actually. Like it depends on the material, what material. See, usually there are like more than 27
materials that are available in the market if you check the literature. And also within the materials also there are single layered material, multi-layered material. So multi-layered materials, they are expensive, but that will help to correct complicated cases like severe crowding and all. So in those cases you can go for a lesser number of days protocol. So that depends on the superiority of the material. That is why material choosing is also a very important thing what you have to see. So even though the cost is a bit high, always go for a most superior material. That will give you the best results.
So basically in aligners also we have options.
Yes.
That's the bottom line. So the patient wants the most advanced, fastest treatment. We have.
So every day it's evolving. Now the latest trend what is upcoming is direct printed aligners. So now we thermoform it. Like we press the aligner, heat it, press the aligner into the model. So now what is coming up is directly you can print the aligner. So that is going to be the future. So every day the field is evolving actually.
Especially when we talk with respect to habit breakers and appliances, habit breaking appliances for the kids. So can we do an aligner treatment even when we have a habit breaker?
Yeah, if it is removable. If it is fixed or banded, then it would be we cannot consider aligners with that. But then certain habit breaking appliances can be inbuilt, can be incorporated with aligners, so that the habit breaking happens with the aligner treatment too. Like for tongue spurs, for example, tongue spurs, tongue thrusting. So then we can give such kind of habit breaking appliances.
But always make sure that if some kind of habit is there, that is taken care of. Otherwise the chances of relapse will be very high. It's always better to correct the habit initially, or like doctor said, if tongue thrusting is there, you can incorporate spurs into the aligners and then
along with the aligner treatment.
So first you correct the habit and
it's always better to correct the habit
with
first.
The aligner treatment. So how do we go about with the maintenance, storing of aligners and maintenance of the aligners?
Actually it's quite easy actually. The patient just has to store it in a container, and then only patient is supposed to wear it at least 22 hours per day. So most of the time it will be in the patient's mouth, and we actually, like, at least when the patient takes it out, we encourage cleaning of it at least once a day or twice a day. And then, like, the patient can, whenever the patient is eating, they can actually store it in the box and then go ahead, like, and then after that it will be in the patient's mouth only. So it's actually, the maintenance is very low key, you can say.
Nowadays, one common problem which patients tell is they go out to have food in the restaurants, so they misplace it somewhere. So, like, unfortunately, sometimes that will be towards the end of the treatment. So whatever movements they have happened till then, that will go in vain. So that is why the responsibility is much higher in patient's hand when it comes to aligners. So this point, many a times it's not highlighted that much outside, because patient compliance is very important. So when you filter the cases, you should make sure that the patient is self-motivated enough to, get the aligner treatment done.
In addition to that, they should definitely contact their dentist when the aligner is broken or cracked, because the movements will, it would get a relapse if the patient stops wearing it. So either they should contact a doctor and tell them to replace the aligner, or they should at least, start wearing the previous aligner so that it doesn't go for a relapse.
That's another hack. You shouldn't discard the aligners once that particular stage is over.
You should keep it. You should keep all the aligners until the treatment is done, so that they will have a safe point.
So if it is broken or if they misses, they can at least go back to the previous stage, so that the movements of the treatment that is done till that stage is not wasted.
So can aligner treatments fail?
Yes, it can. Like all treatments, it definitely, like, there is a chance it might fail, but it depends actually on a lot of factors. Like one thing that we mentioned before, it depends a lot on patient compliance first of all. Like if the patient should be motivated enough to wear it completely. If at any stage in between the middle of the treatment, if the patient, like, is not compliant enough, it can actually severely affect the outcome of the treatment.
And another thing is, if it is not fitting properly in between the treatment and patient is not noticing, it can lead to inadvertent problems. So even if they go to the next stage, that is not going to fit. So that is why it is always easy to correct a problem regarding aligners if it is noticed then and there. And if it is not fitting, so we give chewies also along with the tray. So if it is minor fitting issues and all, they can use the chewy, bite it and get the aligners into proper position. So that is why fit of the aligner is very important. That is one thing all the patients who are undergoing aligner treatment should take into consideration. And also doctors who are treating, when they call for this one visit, so this is one thing they have to ensure, the fit of the aligner.
So I think there is a misconception that post aligner treatment retainers are not required.
Definitely retainers are required. All orthodontic treatments, because we are from a natural position, we are bringing it to a treated position, and it should be retained. If you're not using a retainer, then it's going to relapse, and the relapse is unpredictable. It will not be in the earlier stage like how it was. But so the retainers are mandatory.
So if you go to a biological level or a molecular level, the periodontal fibers, the gingival fibers all play a very big role in the retention. So that is why retention protocol is very important, and which mode of retention they have to take will depend on the severity or the case to case, that will differ.
For example, there is fixed retention, and there is, like, that is what we actually called as the fixed FLR or BLR, bonded lingual retainer, and we have the removable options, the S6 retainers, and the another removable option is like the Beck's or Hawley's retainer. So at least one of these should be worn.
And in spacing cases, you can go for a permanent retention. That will be better. So the chance of relapse is higher in case of spacing.
And in case if the aligner treatment fail, what next?
The patient should, like, first of all, they should communicate with the doctor, and, like, we will actually see, and doctor will communicate with the lab, and we will take the scan. The scan is required.
So if required, we can take the new scan and consider it as a new case and do. That is the only way. So that is why when the problem is, noticed then and there, if the 5th stage is the problem, otherwise what will happen is the problem would have started at the 5th stage and patient will report at the 12th stage. By then, everything would have gone haywire.
I think that is why regular follow-ups are very important in aligners.
Even though the number of follow-ups is lesser when compared to braces, but follow-up is mandatory.
And more than failures, relapses are more in aligners. In addition to, like, if you wear an aligner for a longer time than prescribed, it can relapse. Because the aligner tray is a thermoplastic material. It is elastic, so it would be flexible after a certain time than we prescribe. If we say 14 days or 7 days or 10 days, you shouldn't wear the aligner more than
Beyond
that. Yeah. Unless and until your next, the wearing aligner is broken or something like that. Like some patients, they don't look at their wear schedule, they just wear it for, a longer time and it would relapse. It would have a bad impact on the.
Another thing what we notice is sometimes patients will come back telling that their results have not come.
Yeah.
So when we ask, okay, have you worn all the aligners? Then they will say, yeah, I've worn all the aligners. Then we'll just ask them to bring the aligners. So when we see, everything will be like brand new. They wouldn't even have worn the later stages. So in such cases, we have to always, catch them, because that is why we should make sure that the patients are motivated enough. And it's always better for complicated cases, doctors can give it in stages. Like first 3 stages, let them wear, ask them to come back, then see the progress, then they can go for the rest of the treatment, so that patients will come. Otherwise, the patients coming back for review is very less in case of aligners.
I think in that matter, even removable retainers are important. Like after a certain period,
True.
I think you cannot use it.
Yeah, like you can use it up to 6 months, not more than that. It would become flexible and it would crack. Definitely it would crack, because it is only 1 mm thickness.
So after 6 months,
Yeah.
we have to change it.
Change it. True.
This will particularly be applicable in cases of NRI patients also, I feel, because they'll be abroad and they can't go for
treatment
a
will
permanent
go-
retention even if they want. So we should actually give them a set of removable retainers, but according to the duration, for how long they'll be there till they come back. So we can plan and give
So
them.
with the attachments, we can give the this
Yes.
S6 retainer. So once they come back, we can remove the attachments and give a new retainer. So that there won't be any scope of relapse.
And we should actually, educate the patient, saying that, at least 22 hours a day they should wear. Some patients, they wear it for few hours and they leave it. Maybe when they are going to eat, they'll put it in their pocket and they'll not wear it after that. So that is very important, that at least 22 hours a day.
So all the time except while brushing, eating and drinking hot or colored beverages. Normal water is fine. So except the time while, like I mentioned, drinking colored beverages and hot beverages, then eating and also brushing. Rest of the time, the aligner should be in mouth. So some patients ask, do we have to wear it while sleeping? Definitely. Because this is gonna be an like how traditional braces is. Traditional braces we can apply force 24/7. So at least to get a result at par with that, the patient should wear it for full time. That is.
So we can actually say that compared to braces or conventional treatment, a lot depends on the patients more than the clinician.
Clinician.
Yes.
Yeah.
Right.
So that
Because
is
it's
something
in their hands.
It's in their hands.
Because the whole set is with them, so it depends on how they use that.
use it.
So it was actually a wonderful session and very informative for both dentist and I feel the patients. And I feel aligners are very promising and a very rewarding treatment modality if a good follow-up and maintenance is kept. So thank you for watching. Thank you so much.